anyone that is unable to join can watch this in the future. So this is bleeding, inflammation, and perio charting. So we all know that half of Americans suffer from gum disease. And that number, that percentage, gets even larger as we age. So are we treating it the way we should in our office? A lot of that starts with our exam. And why is perio charting important? Well, first of all, it's part of our comprehensive exam, and it's the evaluation of the gingival tissue and the surrounding structures. It's part of the perio maintenance appointment, and that you must have perio charting in order to get complete insurance reimbursement for your periodontal maintenance appointment. And it is needed for proper diagnosis, early diagnosis of disease, leading to proper treatment, and therefore greatly increasing the outcome of what we do chairside. This is considered the blood pressure of the dental world. If we don't have perio charting, we're doing a disservice to our patient, and we're going to have a hard time knowing how to diagnose properly. So what should be on that perio charting? Comprehensive perio charting, just like we did in school, just like we learned, includes your pocket depths, your bleeding, both bleeding on probing and delayed, recession, furcation, suppression, and mobility. That gives a complete picture of what their periodontal health looks like today, the day you are charting. If a patient is coming in 4 times a year for perio maintenance, it is your clinical duty to perio chart them every time they sit their butt in the chair. We do not know their immediate periodontal health unless we have their perio charting and current radiographs. Okay, the therapeutic goal is to prevent or minimize the recurrence and progression of periodontal disease. That's why you and I all went to school. We have great clinical tools to help us understand what's going on. We know that bleeding is highly relevant to whether we have infection or not in our body. Tooth sites with persistent gingival bleeding are 3.2 times to have attachment loss versus non-bleeding sites over a 26-year period. And this was in the periodontal. Sorry, I lost my train of thought there. I think someone else is trying to come in. Hang on. There we go. Yeah. This was in in the clinical periodontology guide. We know this for a fact. So let's make sure that we're marking bleeding. It's hugely important. And we need to stress when we find these bleeding points, we need to be about this also, right? And then a 2.5-year study of maintenance therapy also showed that the lack of bleeding was a 98% accurate predictor of no further damage. So we know that if we can stop that bleeding, we can almost predict that we are going to lessen the periodontal damage. So again, we've got to chart what we are coming up with in that assessment. If we're leaving it off, we're not doing anyone any good. If we're not talking to the patient about it, of course, we aren't doing any good either. Understand that our blood recirculates every 45 seconds. So if we have bleeding and inflammation in our mouth, and we're not talking to the patient and not telling them, hey, this can travel through your bloodstream. It can go to your brain. It can go to your heart and other organs. We just aren't informing them of what can happen, right? this infection travels through their bloodstream. So yes, bleeding on probing is important. This patient was a gingivitis patient. They had 100% bleeding on probing. Was 48 years old. This wasn't someone who was older. This 48-year-old woman, a non-smoker on Wellbutrin. Um, and we know that Wellbutrin dries out your mouth. We know that can contribute to bleeding. And her gum score, right? Gum score is bleeding points, was 100. That is not good. Okay. You and I both know the lower the bleeding score, the healthier the patient. This person bleeding everywhere. That is not healthy. Chart it, talk to them. When I perio chart patients, I lay them back. I tell them I am going to measure their gum tissue. We're going to figure out where their gum health is. You're going to hear me call out numbers. That's the pocket depth. Then you're going to hear me say bleeding. If we have bleeding, we have a problem. So this woman, we put her on trays because the bleeding was so heavy and everyone was concerned. And 3 months later, she was cleared up and she had great resolution. This is another instance. We have implants. Implants on bleeding on implant should be 0. Why? Because this is periimplantitis when it looks like that left-hand picture, right? This is going to fail. This is going to fail. We know that implants at some point in their life, 68% of them are going to have periimplantitis. Why are we going there? We should have 0 bleeding. We should use trays on these people because it will get them to their right-hand side and keep them there, that right-hand picture, right? So it's really important. So what is their number? Remember, bleeding points is their number. Super easy. Um, Tell them what it is. Give them a hard number. They can relate to a number. They relate to their blood pressure. They relate to their cholesterol. They relate to their A1C. This is all important and super easy for them to understand. Tell them your ideal gum health is truly 0, but anything under health and anything under 10, we're going to consider healthy. But yours, say for instance, they have 68 bleeding points. Their gum score is 68, right? We need to get you to 0. So how are we going to get there? And like I have said before, use this 5-step case presentation. I'm concerned you have a high gum score. Your gum score is 68. That means you have 68 areas of bleeding and infection in your gums. Notice I said bleeding and I said infection, keywords, right? The ideal score is 0 with less than 10 considered healthy. Now, you may want to go to 5 in your office, right? Whatever you all decide on, that's fine. I know you're trying hard at home. It's not your fault, but the problem is toothbrush, rinse, floss, soft picks just doesn't reach deep enough and can't fight that infection at home. That's why our office prescribes Perio Protect trays. This tray is comfortable and it's going to push medication down into your gums so it can hold it there long enough, 10 to 15 minutes to be effective and kill all of that bacteria. You're going to have healthier gums, fresher breath, whiter teeth. But you got to start with your probing, ladies and gentlemen, right? What is their bleeding score, right? Make it their gum score. Make it super simple so they understand. Okay, any questions? Remember, perio charting, bleeding points, infection, Perio Protect trays. This is how you're going to get them healthy, keep them healthy at home. This is a home care therapy. You still are going to do everything you do at the chair, but you are not, but you can't help them if you don't send them home with something. Okay, I saw something in the chat, so let me go there. Oh, I am sending these recordings to Wally and Jody and Olivia and all them, and they are going to put them in your weekly newsletter so that you can access them. And then you should have you can go back and listen to them. Okay, does anybody have any questions? Okay, Christina, do you have any questions? No? Okay. All right. Well, if remember, you all can reach out to me at any point if you have any questions, need any kind of guidance. No, the gel needs to either be bought in your office. I'm not sure where Jody is with that, or they can get it online. They all received a card when they get their cases. They'll receive a card, which allows them to get a discount on gel. And it's just periogel.net. And okay, is there the only difference in the X gel and normal one is yes, there's two. There's the Perio gel, which is our normal Perio gel. It's mint flavored, and then there's Perio gel X. The Perio gel X has xylitol in it. The flavoring in that is 50% less than the flavoring in the regular Perio gel. Um, so it's a lighter mint flavor, but they're both really nice. So yes, that is the only difference. One has xylitol, the other one doesn't. And make sure that patient doesn't have any problems with xylitol. Some people do have issues, right? They have a side effect, a lot of times diarrhea. So just be sure that is there a sensitivity with gel use? Good question. No, we do not find sensitivity with the gel because of the 1.7% hydrogen peroxide. We found that anything over that, they do get sensitivity. Do you get sensitivity? Every now and then, if someone does get sensitivity, we tell them to back off on the gel for one day and use like Prevident 5000 and put that in their tray for a couple times one day, and then they can go back to the regular use. But we normally do not see sensitivity. Good question. Any other questions? Okay, great. Thanks for jumping on, everyone. And like I said, if you have any questions that come up, don't hesitate to reach out and email me, ask your questions. Okay, thank you. Have a great day.